This panel was recorded Friday, March 19th, 2021, during the 15th Annual Public Administration Research Conference hosted by the UCF Center for Public and Nonprofit Management. The panel is titled, Whither Floridata, Decision Making Given Social Indicators on Poverty and Health and Third Sector Organization Models. It is moderated by Dr. Stacy Zavataro of UCF.
Good morning, everybody. We have a small but I know mighty group here this morning with us. I'm going to be here moderating this park panel. My first experience doing a park in a digital realm, so I'm looking forward to it. And I think the great part is it gets people who maybe couldn't get on an airplane to travel to be here with us today, like one of our presenters, all the way from Israel, I believe. That's pretty cool. I'm really excited to have, this panel ahead of us. We are Whither Floridata, Decision Making Given Social Indicators on Poverty and Health and Third Sector Organizations. So I'm to turn it over to our first presenter, Representative Eskamani. If you, when you start, want to introduce yourself a little bit, and that goes for all of our other presenters, and then you'll get into presentations. I will shut my camera off and, like I said, give everybody a time warning. So Representative Eskamani, the floor is yours.
Awesome. Thank you so much, Dr. Z. And does everyone see the slides? I want to make sure. Okay, cool. So again, my name is Anna Eskamani, and we are presenting actually research from a paper that I first worked on maybe about 3 years ago. And then Rebecca actually joined in the final publication of the paper, which we are getting published in a journal based out of a university in Canada. So very excited about that. And so this research is titled, In Her Own Words, the Impact of Poverty on Healthcare Access and Outcomes. And of course, I will frame that research for you. But first, just want to give that brief introduction. And so again, my name is Anna Eskamani. I'm a PhD student in public affairs at the University of Central Florida. Fun fact, as you might already know, I'm also the State House representative for District 47, the state legislature. My co-collaborator in this is also a PhD student. She also has a background in the legislative process. And fun fact, eats a pound of red grapes a day. So that's super impressive. With that said, I'm actually in Tallahassee right now. So one of the benefits of a virtual conference is that I can still participate even when I'm in legislative session. And we are in the middle of legislative session going into week 4 this coming week. So real quick, just the agenda, as I'm keeping an eye on the clock, we'll be going over our research questions, the theories that we use to frame our analysis of our qualitative work, including those methods, results, discussion, limitations, and policy implications. And I will move fast because this is some pretty in-depth research. And once the paper is officially published, we can definitely make it available for folks to read. So for more context, this research was focused on a community that is here in Central Florida, very close to many of our hearts, and that is Paramore, a historic Black community in Central Florida. We wanted to pursue a qualitative study to better understand how poverty impacts specifically Black women in achieving positive physical and mental health outcomes, as expressed by the women themselves. And that was very important to us in this research, and I'll talk about that soon why. So our research questions included, how do participants view the impact of financial barriers on making healthy decisions for themselves and their children? Where do women actually go to access healthcare? And do women discuss other systematic social barriers to care when describing their local ability to access healthcare? And do they also discuss those other barriers to being healthy in their own communities? If so, what are they and how do they connect to poverty? We use 3 different theories to frame these qualitative interviews and to analyze our results. First is the feminization of poverty, which is a theory that grounds itself in the social structures that treat gender differently on a variety of factors that impact poverty. And so, for example, We know that women typically take on childcare duties, especially when families don't fit into the mold of traditional traditional abilities to pay for childcare on their own. And so they have to do it themselves, which means they also might not be able to go to work or work full time. So we look at every issue from a gender lens to better understand how gender could impact poverty. Systematic racism theory, which I feel like most folks in this space probably already know, so I won't spend too much time on it, but essentially it asserts that racism is inherent in many of American institutions, including medicine and healthcare. And then the theory of fundamental causes provides context for understanding the relationship between wealth and health. And this was very important to us because we were providing insight from the perspectives of those who live in low-income communities. And so we wanted to be able to try to understand that connection between wealth and health, and felt like it was a good framework for this research. So talking about our methods within doing this study. So our sample size was 20 female residents. That's who participated in the study. We hosted a series of focus groups that were all taking place at once at the Callahan Community Center, provided a free meal and a gift card as the incentive to also participate in the research. The median age was 41, but it ranged from 21 to 80 years old. As mentioned earlier, majority of participants were African American. We also had children living at home and folks who received Medicaid and Medicare. Many participants were single, unemployed, had a high school education or less, and an income or less of $10,000 annually. And again, participants who lived in the vicinity community for an average of 18 years, but we did have some range in how long folks lived in the community for as well. I already kind of alluded to the semi-structured interviews that we conducted, but just for more context, that's what this slide is for. And so we, as a cohort within the class that was focused on this study, we developed a semi-structured interview guide. It had 6 open-ended questions. These conversations were recorded and transcribed. These were the questions that we asked. I won't go over each one because we're short on time. But you can kind of see that we were, we used our research questions to guide us on these open-ended questions. For the data analysis, so we did a thematic analysis discussion. As I mentioned, we transcribed and uploaded using Deduce as our qualitative analysis software. We use open coding and selective coding to develop our own codes. Really going through the transcriptions allowed us to identify common words and common themes. So we ended up developing 20 parent codes and 16 child codes throughout the research. And we also were able to really use those interview answers in our analysis to develop the themes. And if you do read our paper, throughout the paper, we are explicitly verbatim quoting what residents were saying in an effort to better understand in their own words what their experiences are like and being able to access healthcare, what barriers prevent them from accessing healthcare. And so talking about those results, we broke it down into 3 main areas of focus. Access to healthcare for these residents was primarily the emergency room. Or the health department or free and reduced cost healthcare clinics. But many shared that sometimes those free and reduced clinics were not available to them or the lines were too long. So they could access these sites, but it was not adequate and involved long waiting times. Health insurance was definitely systematic barriers. And of course, multiple participants reported that they did not have continuous health insurance and that changes in their income precipitated the insurance status changes. So I mentioned those quotes, and indeed we do have quotes throughout our presentation today and throughout our final paper. The names are not their true names to protect their identities, but you can just see this statement from Jasmine, age 42, explaining one experience in the emergency room, and so in her own words. She talks about how much of a struggle it is because of the weight that she went through, the lack of treatment from bedside manner perspective, and of course, this alone can be a reason why someone doesn't seek access to care just because of how they feel like they are treated in the experience. And of course, it's very hard to go to work on time if your doctor appointment takes an entire day to get through. That second area of focus for us was just under-resourced. So according to participants, the community is severely under-resourced, making it challenging to support healthy living. Specifically, healthy food came up as a major struggle. Many families communicate to us that they travel to multiple locations just to be able to get food, and that there isn't a local grocery store that's readily available to them that's also affordable. They also spoke about police in their community. Police at times add to their trauma and fear about leaving the house, which further limits their ability to be active. So if their kids want to play outside, there was a concern that if they went outside, they actually might be in danger, in harm's way, versus safely being able to participate in those everyday activities. So another quote from Ontario: she's not let her son ride his bike outside because we've been having so many people dead at least once a week. Someone is on the corner dead or in the yard dead, or the police chasing or running through your house looking for someone. There was a police chase a while ago where the cops ran over a woman on the street. So just to share, again, in her own words, how because the community is under-resourced, they feel limitation to even engaging in healthy activities. And then finally, underrepresented. This was a common theme when we talked about, what role do community leaders play in your living environment. And so residents felt that community leaders were not involved, and they were usually ignored in discussion over decisions about their community. And so, it was Ontario again explained that political leaders only get engaged in resident issues during election years. So kind of a transactional perception of those elected to serve them as well. And this is just one more quote, to provide that illustration. So Mookie, explained how the state or government is always saying there's no funds, but I feel like the reason why they don't do much is because they really don't care about this area. And so that was one of the quotes that really stood out to us. And then, Mookie also explained that's not fair because there's a lot of kids over here that are sick. There are a lot of kids in this area that need clothes, shoes, shelter, and so forth. So that was a very important takeaway for us, was just the feeling of not being represented. So, in that discussion, our findings were consistent with the feminization of poverty, the theory of fundamental causes, and systematic racism theory. And, we outlined in our discussion why. And so we did feel like, consistent with feminization of poverty, women reported specific structural constraints that affected their ability to increase their income and to escape poverty. And so it was very much connected to that the fiscal cliff was described. So for folks who know what that means, if there is this concern for folks who currently are on programs like Medicaid, that if they make too much money, they're going to lose their Medicaid and not have any type of health care. So the fiscal cliff, though that word wasn't used, was described to us. And we did feel like that connected again to the experiences of women in trying to access healthcare. And the fact that they have to choose between healthcare for their children and their own ability to be healthy. And that's obviously a difficult decision to make, but it's one unique to many women in society. We also saw that participants reflected desire to be healthy, but consistent with the theory of fundamental causes, they did not have the resources needed to be healthy. And then finally, as you saw in the first experience shared with us, when participants could access medical care, they experienced systematic racism, where the care was inadequate, consistent with systematic racism theory. So the theories that we framed our research on very much reflected in the qualitative results that we had. Of course, we had limitations with our study, like with any study. There was potential organizational environmental factors that could be influencing health outcomes. There is a need for broader research to get a clear picture of women's challenges in accessing healthcare. And of course, factors could change over time. This research was just a snapshot in time. It wasn't longitudinal. And so, of course, things could change. And I think it would be super impactful to revisit those participants and to be able to follow them over time would really glean some incredible insight. But of course, there are implications from this one snapshot in time. We do recommend that intentional efforts should be made to continue the meaningful dialogue with residents from what we called as the vicinity in our research at a municipal level. The city and county should budget for improvements in park facilities to ensure they have adequate equipment and are clean and safe. And at a state level, policy initiatives that supplement income and improve continuing healthcare coverage can reduce poverty and lead to downstream health effects that will positively impact all people. So policies like expanding Medicaid. Of course, with the American Rescue Plan, there are several anti-poverty initiatives within this $1.9 trillion congressional relief package. And one of the provisions within the American Rescue Plan includes expanding Medicaid coverage for postpartum women for a year. Right now, it is only available for 60 days after a low-income woman gives birth. States do have to request to apply. They have to actually express a desire to participate in that extension. But programs like that would be transformational for many of our communities. And that wraps up, our PowerPoint. I know that was a little fast, but I want to make sure we kept within the time frame. But Rebecca and here are here and happy to answer any questions that folks have. And I think we'll take questions with everyone at the end, but look forward to hearing what folks have to say.
Thank you so much, Representative Escamani. You were literally right on time as my timer went off. Right on time. It was perfect. So the next presenter is Dr. Uster.
Yes.
So that sounds great. You should, I think I have to give you the co-host ability. Hang on 2 seconds. Okay. You should all have co-host ability to share screens. And like I've said before, I will put my camera back on for kind of a 5-minute warning. We have 15 minutes if you want to keep time on your own ends. Sounds great. The floor is yours.
Thank you very much. Thank you for all of you. First of all, for the opportunity to present in this forum. It's very interesting for us and exciting to present in the forum where most of the cases are American cases, and we really want to share our certain particular and very unique case from Israeli case about the relationship between government and third sector organizations during COVID-19. First of all, Asnat, she's here. Our names are reversed, and she's PhD student and she's co-author. And I'm a researcher from Emek Israel College in Israel. And we want to understand, the main purpose of this paper is understand the government third sector organizations' relationships during the crisis time, during the COVID-19. In order to understand it, we do two main things. First, we want to analyze the past, the relationship in the past. We want to analyze the relationship in the present, in this year, and we really want to develop some propositions for the future, how this relationship will be in the future. Why we are talking about COVID-19, it's not only because it become a keyword in the today's research, but because COVID-19 is the crisis. It's expressed the crisis period. It's the emergency period. And as a crisis, it's expressed the ability or inability of government to make right decisions. It requires from government to be more creative. It requires from government and other policy actors to act in the conditions of uncertainty. And we believe, as Nat and me, we really believe, drawing on the literature on crisis, that this certain period could reveal the real and hidden elements of the relationship between third sector organizations and government. So a little bit about Israeli context. Third sector organizations, in this paper we will refer to non-profit organizations, because in Israel it's very, very general concept for third sector organizations. It includes many kind of organizations. We refer to non-profits which are devoted to provide social services, social and welfare services. If we will base on Anhar and Salomon and Young typology, these nonprofits, they play a complementary role to the government. And government, local government in particular, they are dependent on these organizations in order to provide public services. I have to mention that this situation is increased, especially in the beginning, 2003, when our current Prime Minister, he was a Minister of Finance, and he enhanced and promoted the neoliberalism. And this approach, neoliberal approach, created the situation where government and local authorities become dependent on non-profits as an executive arm for service provision. What happened in COVID-19? In COVID-19, as in the world, it's very similar to the other countries, but in Israel especially, we have non-profits who are damaged, their activities and their service provision were damaged because the COVID-19. And they demanded from the government to help them in two main issues: the tax relief and budgeting assistance. And these are two main issues that we will use in our analysis. We will refer to it, but you can see from this slide the citation from someone who is the CEO of one of the biggest nonprofits in Israel today. He was a politician a few years ago, and he tries to express and he tries to deliver this message to all the public, how these organizations really were damaged by this crisis, especially in regard to the budgeting and the regard to taxes that they should pay. So he highlights here, and he presented there are associations that are in a terrible crisis, serving the children, the elderly, the adults, and Holocaust survivors, who's not. They are doing everything. So this citation, I think, expresses the prominent role of nonprofits in the Israeli policy. Here we can see crisis in numbers. First of all, it's interesting to see the gaps between the budgets that were approved by the government and the budget that these nonprofits actually received. You can see the gap between the orange and the blue. So you can see that during the years, we see that in 2020 and 2021, we have a real, very critical decrease in the government budgeting. So COVID-19 is very, very challenging period for nonprofits organizations, and in their perceptions, they stopped most of their services. They canceled some of their assistance, and they feel that small organizations, for example, they cannot survive and stopped to act. It will be interesting later, we compare these perceptions to actual and real activities of these organizations in parliament. We have their perceptions, and on the other hand, we have their actions. So we want to know if there are a gap between the perceptions and between the actions. but we will do it later. And before we're going to analyze this relationship, we have to identify institutional dimensions. What do we mean by institutional dimensions? There are four main, very important agencies regulating the activities of nonprofits in Israel. The first is corporate authority. Corporate authority has a minor influence on this relationship because it's mostly responsible for the establishment of nonprofits. Taxes authority is very, very strong authority in Israel, and it is responsible for the taxes relief, and taxes reports. The general accountant of the ministry is one of the centralized and strong ministry in Israel. The general accountant is responsible for budgeting approval, and delivering of the budget. And we have government offices which works with these nonprofit organizations, and we have to say that in Israel they have very limited ability. They have very limited organizational capacity and autonomy. And government offices, they're very politicized by politicians, and they don't have very clear policy toward these nonprofit organizations. So we decided to focus on two main institutions, the taxes authorities and the general accountant. When I say we decided to focus on them, I mean that through our analysis, we will analyze the actions, the incentives, the main ideas of these institutions and how they act toward the nonprofits. So how we do it, we decided that the most appropriate theoretical framework for us, it could be neo-institutionalism. Neo-institutionalism really could help us to explain what happened before pre-COVID, and maybe to develop propositions what be after the COVID. So we use two main institutions, as I already explained before, 2 and 3, and we use the practices of these institutions, their actions, and we try to see how they did act before the COVID. I will show you the timeline, what kind of changes they did, whether there were changes, how this change, helped and affected the relationship. After this analysis, we go to the COVID-19 period and we use the discursive institutionalism in order to explain the construction of the policy, the communication between the policy actors, their message delivering to the public, and what are the main incentives of policy actors to change the relationship between two sides. Here you can see the timeline of the relationship between third sector organization and government. I have to explain it a little bit more. You can see that the timeline includes the years from the establishment of the state until the COVID. We can see the type of relationship, for example, the symbiotic phase, the paternalism, and the isomorphism. It's very similar to other countries, but what is different, it's the different actions and practices that we have in Israel. For example, in the beginning of the relationship, there was not any distinction between nonprofits and politicians, between nonprofits and government. Only in the period near to COVID, we have a government resolution which decided to speak in the terms of governance, in the terms of collaborative governance, and government decided to speak in the terms of collaboration. So in 2017, we have a government resolution about the collaboration between third sector organizations, and government, and how they should collaborate in emergency resilience, in emergency time. So if we look on this, it's so obvious that the state, the government, and the nonprofits should be prepared, in Israel at least, should be prepared for COVID-19. But what happened in COVID-19? In COVID-19, we see from our analysis that we did, that we see the pattern of transformation from governance back to government. And we see, we're trying to analyze who are the policy actors. We're trying to analyze how they collaborate with each other. And we can, for now, I will skip it, and we can, on the for now, because we are on the analysis process stage, we should interview. But for now, we have some propositions, initial propositions. First of all, we see that all this governance discourse become less relevant, and governance transformed to government. The practices that they used to use before, like collaboration roundtables, collaborative practices, probably will not relevant after COVID-19. We see and we propose that the dependence of the third sector on state funding will be changed, and it will be less, and it will require from them to improve their skills to get the money from philanthropy. And another important propositions that we see that local government will be more, will be stronger in the relationship with third sector organizations because the local community becomes very demanding, because very local community voices their demands, and local government will be a major actor in the relationship with these non-government organizations. I tried to finish before, so thank you, and we would like to hear your comments.
Thank you so much. You also had perfect timing, literally, right on the dot too. So Gary, you have a lot to live up to. Thank you so much. That was really interesting. I do have a couple questions for after, and I hope others do too. Dr. VanLandingham, if you were able to share your screen, the floor will be.
I will do so. Thank you.
The same thing, give you the flash.
Okay, thanks for the opportunity. Welcome, everyone. What I want to do is to spend a few minutes talking about where the state of Florida is in evidence-based policymaking. And this builds off a series of reports that the Leroy Collins Institute at Florida State has been doing really for about 15 years, looking at where the state of Florida is in terms of its fiscal capacity and the needs of the state. And we've, for a long time, pointed out that there really is this fundamental disconnect between the state's revenue sources and the needs of a continually growing state. Florida traditionally has been a very low tax state with a very narrow tax base. Florida is one of the few states without an income tax. We tax sale of goods, but not services. And there's a ton of exemptions. For example, Florida is currently one of the only 2 states that does not tax internet sales. What this means also is that our tax base continues to narrow as more and more of the state's economy moves to the service sector, which is untaxed, and to online sales. And state revenues adjusted for inflation have never recovered from the Great Recession. Florida, seeing as our economic base is selling overpriced real estate to people from up north, we were the first state into the Great Recession. It started here a year or about 18 months before the rest of the state. The blue line here is the average state, and the orange line is Florida. So Florida had a deeper recession. Our revenues were down about 28% at the depths of the recession. And adjusted for inflation, we've never made it back up, mostly due to a few characteristics, not only in terms of our revenue system, but the state's economy in general. What this means is that we continue to face a lot of tough choices in terms of where we want to be when the state grows up, how we want to allocate the limited revenue. And we have serious challenges. Florida is 35th among the 50 states in terms of the status of our children. We have a very high percentage of our children who are growing up in poverty. Educational performance in reading and math, which we heavily test, is significantly below the average states. Higher education funding is among the lowest in the country. Our average wages are only about 87% of the national average. That's mostly because we have a service economy. Florida is a big tourism state, so we have lots of jobs in hotels and restaurants and theme parks. They don't pay that well. Also, we have a lot of retirees. Our prime workforce is only 37% of the state population, because once people hit about 65, they leave the workforce, and we have a lot of low-income people with large families and kids who are under 16 just don't work that much. So the question is, what do we do about this? How do we chart a path forward? And we believe that the best path forward is to spend the limited money that we have better than we've been doing it. And evidence-based policy approaches, we believe, can help the state do this. There's been a lot of buzz about evidence-based policymaking for about the last 10 years. And the overall rationale about that is that we now have a ton of very good research on the effectiveness of a lot of programs. And that research is clear that some programs just work a lot better than others. There's a lot of ideas out there. They sound good when you think about them, but when you put them into effect, they really just don't work, or they don't work very well. Many programs have little impact. Some actively harm people, even though they sound good on paper. But there's a subset that really are very successful. An example of this is a recent set of randomized control trials on teenage pregnancy programs found that only a third of them actually move the needle in terms of policy outcomes. So evidence-based policymaking says, why don't we target money towards the programs that work, that have been found by rigorous research to generate both high returns on investment, a good bang for the buck, and also moving the needle in a tangible way towards the solutions, the problems we're trying to deal with. And this is an approach that really gets past the political polarization we see, because conservatives like the idea because they view it as something that's going to tell them what they can cut. Progressives like it because they feel this will tell them how to actually achieve social improvements. And one thing about evidence-based policymaking is it is a comprehensive approach. I would say that the easiest way to think about that is to say, we should look comprehensively about what we're doing now and look at whether those programs we're doing make sense, whether there is evidence that these programs are working or not. Then we should fund programs that actually are working. However, that's only part of this, because a good program badly implemented isn't going to move the needle either. So we need to pay more attention to whether we're doing programs the way they should be done, and also then track those outcomes so that we know whether these programs are working for us or not. And finally, we need to continue to innovate, but test those innovations. We shouldn't freeze programs' effect. The world continues to move on. But basically, this overall approach says, let's use evidence and data throughout the governance process to really come up with a governance system that is informed by evidence, recognizing it's always going to be political. So in the study, we asked, where is Florida on this path? And we found, well, Florida's not very far down this path. The state does not have a comprehensive list of all the things that our agencies are operating. There's very little data out there on whether our programs are effective. There are a few metrics. They get very little attention in the policy process. There are very few funding preferences in law to say, agencies, when we're giving you money, we want you to spend it on evidence-based programs. Program monitoring and management is often very weak. That tends to be the first thing cut when budgets are tight, training and travel for monitoring. Well, budgets are always tight in Florida. We just don't do a lot of that. And we have very limited evaluation capacity, particularly within the executive branch, to really test whether new interventions are working or not. So while systemically we are weak in this area, there is some good news. Some of the agencies we looked at have done some positive things in parts of this. For example, the Department of Children and Families, which runs the state's family services program, particularly addressing child abuse and neglect, has established it's working to build a better system to monitor how well that system is working. And they developed now a performance measurement system where they have monthly indicator reports saying what's going on and what's working at a county level. However, DCF has not really looked at whether its current programs are effective or not, hasn't mandated that its subcontractors use evidence-based approaches, and really lacks an evaluation capacity to say whether things are working well or not. Department of Health is a leader in this area. They have a very strong strategic planning process. They have a good monitoring and outcome tracking system. And they conduct this in a very disciplined way. It really is fairly impressive what they're doing. For example, they track on a routine basis over 3,000 public health statistics, 100 internal performance measures, and they've got a good program for monitoring implementation and improving performance. However, the department continues to lack some on-site evaluation capacity, and keeping track of all of its programs can be a challenge. Juvenile justice has done the most in targeting programs, funding towards evidence-based programs, particularly for the programs that are serving children who are really getting into serious trouble and have been removed from their families and put into residential placements. It conducts fidelity and compliance monitoring and monitors some outcomes, though it struggles to do that. It lacks an evaluation capacity. And these are probably the agencies in Florida that have done the most. Other agencies really have just dipped their toes into this overall approach, but the state as a whole has a long ways to go to be able to say we're spending money the best way we can. So where can we go? Well, we are suggesting that the state's leadership take several steps. One, let's figure out what we're funding, come up with a comprehensive list of state programs, assess whether the evidence shows those programs are effective or not, develop the capacity to conduct benefit cost analysis to identify and compare the return on investments. There are now very comprehensive benefit cost models that have been developed in Washington State. Around 20 other states are using those models. Florida is not one of them. Establish some policy preferences for funding evidence-based programs so that when agencies are given money, the legislature would say, we want this money to be targeted towards evidence-based programs rather than programs which lobbyists or advocates could say, give us the money, even though there's no evidence that those programs would be successful. We need to work on building a better performance management system, training agencies and staff how to do this well. I think that given Florida's budget situation, this is something that the university community is going to have to take a leadership role on and establish partnerships with government agencies and nonprofits who are delivering these programs. And we also just need to strengthen our overall performance management system. Now, this can be done. There are other states out there which have similar fiscal constraints who are really much farther down this road than we are. New Mexico is a large, rural, and relatively poor state, but they are really a national exemplar in doing this. And the reason for this is that for the last 20 years, the state legislature there has said, we don't have a lot of money, we need to spend this very well. And they developed the capacity to track key outcomes and issue agency report cards, which come out once a quarter, that are tracking key outcomes. These are public reports. They're given to all members of the legislature. They tend to drive a lot of legislative attention. It has a very good legislative evaluation capacity that's part of the Appropriations Committee that has really done some outstanding work tracking things like educational achievement in K-12 schools, and identifying what the impact of its investments in early education have been. And the legislature regularly tells agencies, here's some money, you need to spend this on something that's going to work. And we're seeing that because of these steps, New Mexico is making very rapid progress in improving the lives of its citizens without really spending much more money. So this is an approach that we feel is showing a lot of benefits around the country, and it's being used in more countries around the globe. Florida, however, is lagging in this. And if we want to see a better state, then I think that our political leaders need to start making better choices and using evidence much more strategically and consistently throughout the process is, I think, the way, and probably the only way, that Florida can significantly move forward. So Stacy, I'm going to give you back some time because I think it's important to have time for discussions.
That sounds great. Thank you all so much. I appreciate it. Let me stop my clock so it doesn't go off. Okay. So I think we are into the Q&A. I have a couple, but for all of our guests and listeners, please, if you would like, I think our panelists are more than happy to make this a discussion for the last little bit we were here. So please use either the raise your hand function if you'd like to come and speak. I will try to go through, and Brittany can help me if I miss a hand. That'd be great. Or if you're not comfortable doing that, if you are still in your pajamas, for example, you can go ahead and type in the chat a question, and I'll try to read it in case somebody is on a phone and can't see it. Okay, so while you're thinking of your questions, because I know you all probably have a lot, I just wanted to, again, thank our presenters. So I have, if I don't see any hands, I'll start. I have a couple of questions. So when I was just listening to you all, how I was trying to understand was kind of through this lens of, and Asnat, you really helped me like solidify this in my head. Your presentation was a lot about change, right? A lot about, this institutionalization of things and how things get, maybe solidified, and then this punctuation happens and we have to rethink it. So I heard that kind of from all of you. So I'll kind of just go, in order, Anna and Rebecca, could you maybe walk us through how you came to this project? I know, Anna, you kind of said in there was a group working on it. And how did you, I wrote this down, how did you kind of identify that particular community? And 3 is, you talked about it at the end, and this kind of ties to Gary's in my head. What do you both see going forward, with their findings?
That's a great question. So this research was very much the product of UCF expanding downtown. And candidly, one of my biggest criticism of that decision was I feel like this research should have been done a long time ago versus when UCF is going downtown. And I think that's another reflection of just like, as researchers, but also in my case as a public official, like we should be asking questions even when we're not included in that problem. And I think for UCF going downtown, that decision kind of catalyzed a lot of this intentionalism to say, well, we should learn more about the community we're moving into. And my argument would be, you should learn about the community before you even thought about moving into it. And candidly, there are researchers at UCF and students who've done a lot of work in Paramore, but Paramore is also gentrified and has been gentrified for decades. And it's not slowing down at this point. And so I think our recommendations, stress like more local government engagement, and really those are recommendations that you should have been provided, like I said, a long time ago. But as students and as the next generation of leaders, for us, I think it's super important that we take this research seriously. When the opportunity presents itself to learn about our neighbors more, we should do that. And that was the catalyst of this research. Was Dr. Kim Anderson is one of our co-writers on this, and she's a very intersectional and intentional person and professional. And so it kind of just turned out to be mostly women who participated with us. This really was grounded theory in the sense that our paper was developed based on the participants we had. We invited everyone in the community to come, but the sample size was mostly women. So when we did our research, we focused on that segment of the sample size, because I think the sample size was maybe 35, it was a larger number of participants. And I hosted one of the focus groups, and my group of 6 was multi-gendered. But because we had this great sample size for women, we just focused on the women's lens. But that data set was analyzed by multiple different groups of student researchers. So the data gleaned from it offered some great perspective on social determinants of healthcare from different age perspectives, community safety perspectives. And as for some of our colleagues, they've actually continued doing that research, diving deeper into the subject matter.
Really interesting. Thanks. Asna, you had a question maybe for, you typed in the chat for Anna and Rebecca.
I have a question to Rebecca. Thank you. First of all, thank you. It was very, very interesting and I think very important topic. When you presented the perceptions and attitudes of your participants, I was wondering, what the role the trust to these institutions, the trust to these agencies, the perceptions about whether they against me or support me, how do these really could affect my interpretation of their attitude toward me or interpretation of the policy.
Yeah, when going through the transcripts, there was obviously eroded trust between policymakers. A lot of that sort of went into some of our findings that they only come around during election years. And that was like juxtaposed with all of their saying that they don't have adequate facilities. They don't have playgrounds. There's playgrounds in other areas and there are safe streets, but not in their own community. So it all sort of played into each other where there was sort of no hope of it getting better. We didn't specifically identify that as a theme, but it was a general sense of, well, nobody cares about us. We would have to make it better ourselves. And we don't really have the resources to do that.
That's interesting. And that kind of goes a little bit to, I think in my head, Gary's presentation. And, I'm curious, well, Anna, you don't have to answer this question, but like based on what Rebecca just said, like, how are you, I see you on Twitter, how are you working to like help overcome that narrative, right?
Yeah. So candidly, we didn't talk about bias in our paper because when I did this research, I was not elected yet. I actually had just declared my candidacy. So I was in this really weird place of, being a researcher, but also being a candidate. Now, the community of Paramore is not in my district. It's right outside my district. And since my election in 2018 and re-election in 2020, I've done a lot of community building work in Paramore alongside the representative of that district. In an effort to also be intentional in my efforts to build community and build efficacy, but also to build that trust that Asnat spoke of. And so looking towards my district, gentrification is also present in my district. Hannibal Square is in Winter Park, and it's the Black labor that built Winter Park, and there hasn't been a Black city council member since 1892 in Winter Park. So and one of the first groups that I met with when I was that candidate in 2017 was Hannibal Square Heritage Center. And I've been like this, with those community leaders in supporting them in some of their efforts to increase representation, to stop the gentrification, and to build community. And so I do think as policymakers, we have to be very intentional in showing up, even when there's nothing that we need. I give without expectation, and I do think that that's a contrast to most politicians and elected officials who, give because they expect something in return. And that's the dominant culture we're trying to combat, in my everyday work. But I would also argue in community participation research, because when we're researching with the goal of community engagement, then it's not about my opinion or my assumption or my beliefs. You're the one telling us what's going on, and we're going to take your word for it. And I think that contrast is so freaking important, to create spaces where I'm not the one in charge, you're the one in charge, and to kind of like take off your shield as researchers and policymakers. It's the best way to actually solve problems together. Because again, even there were some conversations I remember during those focus groups around telehealth, right? And is telehealth, expanding your access to healthcare? And of course, during the pandemic, we've seen telehealth really increase as well. And a lot of folks are saying this will dismantle barriers. My response is, well, if you can't afford the technology, then you're still without healthcare. And if you don't have health insurance or any money, then you're still without healthcare, because telehealth ain't free, right? So we have to, again, like frame ourselves in the perspective of directly impacted people and really understanding what their challenges are. And they will tell you what the solutions are. And I do think that out of our research, very clear solutions are present. And that's what our recommendations are for policymakers to pursue those solutions in order to start building that trust and also building better health outcomes long term.
Thank you. I'm looking forward to reading y'all's paper when it's out. Please send it to me. Asna and Anna, I have a couple of questions. Thank you again for your presentation. I saw Naeem. Naeem, you put your camera on. Did you have a question before I ask mine? You can certainly go ahead.
No, you can go ahead, but I can ask or have a brief kind of a comment on the three presentations. I think the common thread I can see all three is trust and collaboration, and potentially suggestions for capacity building in terms of a better outcome. But I think one thing is missing, the way we communicate, right? So if you can probably address what we mean by evidence. So we have different kind of evidence in Anna's and Rebecca's presentation, kind of an attempt to collect different evidence from Anna and Asna's presentation. And of course, Gary, with his background, had a different perspective on evidence. So the way we collect the evidence, I think this is more philosophical question, how we value evidence and how we communicate with the community at large in building trust as well as moving forward. So it's not just telling them this is what we found and this is the right thing to do for you, versus we collectively produce something and this is good for a lot of us. So any observation on this, the way we communicate?
I can just touch on that really briefly. Thanks, Dr. Capuccio. I think that's what's so key about our study is that there already is a lot of like scientific and empirical evidence that there are health disparities in underserved areas, but there was lacking like more qualitative evidence from people's actual perspective of their lived experience. So I think that adds to it to go in and like triangulate the findings to confirm it, but also provide a little bit more context, at least as far as our study is concerned.
I would add that there's clearly evidence is a continuum. On one side, you've got randomized controlled trials. On the other side, you've got folks with ideas. And typically, you'd want to recognize those. You need both qualitative and quantitative evidence. You have to build theory as well as test it. And you just need to build that capacity so that people are thinking always, is what we're doing working? Or who, under what circumstances? Let's continue to learn and how to improve the system. If we're doing that, then we're on a good path, because just recognize that there's huge inertia in the system. So we never ask those questions and nothing ever changes, and then we see higher and higher levels of disparity.
If I may add, I am sorry that I joined late to the session, but I would like to add that in our case, the phenomena of the crisis was so drastic, but from the reaction of the nonprofit organizations, they crashed. All of their activities crashed, and you couldn't, see the time before. The government and the nonprofit organization had a very, very, very long-term work on an agreement for mutual work in time of crisis. And this work was just vanished in the crisis of the COVID. And the fact that it vanished was very, very, very strange phenomena here in Israel, because, in Israel, we have lots of methods of working in crisis and in emergency times. And this crisis was so different from all others that the phenomena of this crash, with the fact that we know how to work with crisis and all the discourse and the changes in the institutions through times gave us a very, very rare opportunity to check it. So the discourse here is very critical, because maybe, and this is why we took this discourse institutionalism approach to ask these questions, because maybe there are the answers for this different situation. I think it's an opportunity that here in Israel or all over the place, it's very rare. For us, it's rare because our knowledge about crisis, practical knowledge, is so different from this crisis. And the field reacted very strangely. And the questions about the future is even more big. So I do relate to the question about the discourse. I do believe through the analysis of the past, from this perception, that it will give us the different explanation.
Naeem, any reaction to that as somebody who studies crises?
No, this is fine. Emma explained some of these as part of her reaction, and I think I'm appreciative with the responses from everyone. Thank you.
And I want to build off of that too, those questions and Anna, your response, because that was something that struck me when Asna and Anna, you were in your presentation. So can you maybe speak again to kind of, it was the slide where you were showing kind of like Anna was just saying, like the different sort of institutionalizations, and then you have the crisis on this end. So I'm not sure how to ask it, so just like go with what's coming out of my head a little bit. Do you think that the crisis of COVID is an opportunity to push out these third sector organizations, or is it going to be an opportunity to like restructure that relationship? Because I know in the end y'all said, a new skill having to be depending on maybe fundraising, whereas, here we saw a decimation as well, but a turn toward fundraising and a turn toward, oh, I'm an arts center and I can't host big crowds. Let me do something on our front lawn, like our art center here is doing. So I'm not sure if that's making sense, but.
I like your question, honestly, because it's a very, very good question in regard to government behavior toward the nonprofits. Can I share this slide this time? Okay, just a minute. It was this slide, and what we see here that most of the relationships was most of the time, the relationship was characterized by the dominance of the government and the government very centralized decision making. From the beginning of the state and until 2017, I think. The paternalism and the centralization is one of the main characteristics of the Israeli state, of Israeli central government. And it seems, again, it's on the initial propositions, initial insights, but it seems that government, there is, first of all, a huge gap between the government message and the government discourse and the government actions. And when we try to see this gap, we try to understand why this gap occurs, what are the main incentives for saying X and doing Y. And we understand that central government in Israel really wants to keep being centralized and to create a reality where the nonprofits are less dependent on it. And when you can give this task or mission to local government and to make local government to be responsible for nonprofits and to, for example, use the discourse, these are the issues, local issues, so local government should deal with it, with nonprofits. It seems like really central government tries to be more centralized, to be more patron, to use patronage, and to create the reality where central government will not give a budget that he used to give before the COVID-19, to make the reality different, that non-profit organization should learn how to get money from other sources, but not from central government. I hope I answered.
Yeah, really.
May I add, and I can also add that there is, we believe that, we did most of the analyzing. We didn't bring it as a result because it's not yet, fixed. So, but we believe from what we did so far that the ambition of the government to build the cooperation with the nonprofits organizations before the crisis, it can show, the analysis can show that it wasn't sincere. It was only from the mouth out. It was not a real one. The crisis showed it because it collapsed. It broke. It didn't hold. It wasn't authentic. And we believe that this experience for the nonprofit will be to go back to be more self-autonomy, not to wait for the authority to give the permission or the space to act. They will be more and more self-dependent, both by funding and also by acting. But you see, now in Israel, we have a very, very critical point in the political point of time, because next week we are having elections, and lots of things are going to be organized again. But it is, and things are happening ongoing. So it's too early to say, but we believe that if we will be able to give the message to the nonprofit organization to act and understand that what was happening till now, they need to to build resilience within more than dependency on the governments. And this is very, very important for the all the services, because most of them are delivered by them. And through the crisis, we left with no services almost.
That's really interesting. I hope y'all publish that paper too. I'd love to read it someday. I do have a question for Gary, but Naeem, I saw you put your camera back on. Did you have a question or a comment? No. You're muted.
No. I want to make sure I'm with the people. That's it.
Okay. I just wasn't sure. So my question for Gary, which I'm sure is one you get a bajillion times, and it's going to be bajillion and one. In your experience, what do you see as that sort of resistance for this state kind of adopting an evidence understood broadly based sort of policy practice? And in your conversations, kind of how do you try to poke people toward something like that, if you do, and if you think they should?
Well, I think the number one thing that Florida will need to move forward are champions within the process. I'm optimistic. I mean, I've looked at where all the 50 states are in this, and this is something that red states like Mississippi, blue states like Washington State, purple states like Colorado, it is something that can work, but you need to have people who bring it into the process and establish really some founding principles on this. Things like defining what we mean by evidence, things like a general legislative policy that we should pay more attention to this, and when agencies get discretionary funding, then report to us how you're going to spend this money and your procedures for ensuring that you're going to be able to track the outcomes of that. And in Florida, we've just seen that there's been this movement, slow and steady movement away from sort of an evidence focus for a long time. If you go back to the 90s when Florida tried performance-based budgeting, we started out with performance measures in the LBRs, and then the legislature would hold hearings on them, and then we would see them in the Appropriations Act. And they got moved out of the Appropriations Act into the Implementing Act, and they got moved out of the Implementing Act into an Appropriations Ledger, and then they got moved out of the Appropriations Ledger into long-range program plans, which frankly nobody pays much attention to. And there just hasn't been this push really on any part of the process, except at the agency level, to really bring this into the governance process. And it's not a heavy lift to do this. I mean, these are things which pass pretty unanimously in most legislatures. It's just you've got to get either leadership from the executive branch or some legislative champions, and that just has to happen. And there's so many other issues always competing for attention that paying attention to sort of this nuts and bolts issue, you've got to get people on board with that. And there's been efforts to try to do this in Florida for a long time, and it's just never really moved forward. I mean, when Florida did the Government Reform Act in '94, it was pushed by two members who immediately left the legislature. One moved to Congress, one moved to a local elected official, and after that, then the bottom caved out because there were no longer any champions there.
Interesting. Asna, I saw you had a question for Gary.
Anna, Gary, thank you for your presentations. It was very interesting for me to see that you pointed out the specific agencies who took positive steps. Mm-hmm. And it's very interesting to hear whether there are some organizational or financial factors which helped to these specific agencies to act differently and to take these positive steps to be different from other agencies.
Some of it is due to the policy area they work in. I mean, public health is a science-based discipline. And particularly the CDC has done a lot of emphasis on community health planning, of sort of mandating that the national accreditation agencies for public health agencies encourage agencies to do this. And there's just a lot of evidence out there about what works. I mean, the whole idea of randomized health trials, it's just part of the way that people think in public health. In terms of juvenile justice, I think that comes from the concern about juvenile justice that started really in the 90s. Florida made major investments in that, then did what every other state did and pushed fads. I mean, we set up boot camps, which research shows are ineffective. We did a lot of things with good intentions that didn't really have much impact. And then as that science of what works began to come to life in that area, then we had, in some cases, legislative champions who were very interested in this, secretaries who were very interested in this, and it sort of slowly built into the culture there, where they're now very focused on doing evidence-based interventions. And when I was at APAGA, we did a number of studies showing that this was just saving a ton of money. A good program like functional family therapy had saved the state over $50 million, just in terms of what the state would have done without that. So again, I think that there's an area, there's a lot of evidence there, and a lot of evidence, particularly in reform of juvenile justice. That's an easier lift than adult criminal justice is. In DCF, the state basically has contracted out all children's services, and there have been several attempts over the years for the state to sort of gain more control over what its lead agencies are doing. Basically, the state is divided into 20 lead agency service districts. The state contracts with a nonprofit or private provider to coordinate services in that district. That provider then subcontracts with service providers, and the state has a very indirect knowledge of what's really going on. That the state has tried for a long time to build a monitoring system on that. The providers push back, saying that this should be community driven. And typically what happens is that there is a scandal and the state then is more willing to step back into this. And so what we saw is that after it became evident that we were losing kids because the lead agencies were not paying attention to where kids were, and then, oh my God, they died 5 years ago and they never even told the state that happened. Then we've got to start getting a better handle on this again. So the state is about halfway through, I think, another attempt to really build a better monitoring system. But that has to be an ongoing process. So they've made some steps, but particularly in terms of being able to monitor outcomes, but in looking at what services are really being provided at the local level, we don't have much of a clue on that. And in other agencies and at the policy level, there just hasn't been, a focus on let's think systematically about what we're doing in terms of how we are choosing and delivering services. So that really is, it's a good government thing that people sort of smile and give some, a limited amount of love to, but not really thinking about, if we want to do better, we have to pay much more attention to how we deliver public services than we do. And we just sort of assume that agencies have the capacity, have the knowledge to do things on their own. And particularly in Florida, a state where we've given 3 pay raises to our workforce in the past 13 years and have continued to cut things like oversight and monitoring and all of that. And in a political environment that is just whatever the government is doing is bad, then I think that it's tough to get the attention of people who drive that system. And I haven't seen that changing anytime in the past few years. But I would be happy to come and talk to caucuses or member staff about this and what's possible.
Well, I did see in the chat that Representative Escamani has a question for you, yes. So here's a good segue.
Yeah, actually, it's great to be introduced to you, Dr. VanLandingham, because I would love to see how to get you more plugged into the process. I had a question about OPAGA reports, because My understanding is that OPAGA in particular is a great resource that Florida has compared to other states, and it's an objective source of, analyzing programs, not to the degree that you shared with your research. But I'm curious, how do you see, what's your perspective on OPAGA? My perception is that it's not well utilized by the legislature. I read OPAGA reports, but I don't think a lot of my colleagues do. And it doesn't seem like policy comes from OPAGA. Oftentimes it feels like OPAGA is used to fit into a political perspective versus allowing OPAGA to dictate policy. It's almost as if you try to find the right study to fit into your political beliefs, and then you pursue that policy. But would love just some of your insight into OPAGA and just, what can we do better to use that data, and how can OPAGA be better too?
Well, as disclosure, I led OPAGA up until 2010.
Oh, wow.
And OPAGA's role has changed substantially since then. When I was with OPAGA, I was appointed by was designated by the Joint Legislative Auditing Committee, and then was appointed and confirmed by the full vote of both chambers for a 4-year term. And I had total budget flexibility. We tried to work very closely with leadership and with the committees to identify what things we should be looking at. But the rules were really, legislature, you get to pick the questions, we get to tell you the answers. We will do so in a professional and respectful way, but our motto was speaking truth to power. I found myself increasingly in the role, though, of being a purveyor of inconvenient news, meaning that as the legislature changed when term limits fully took effect, the institution became much more top-down driven, and leadership wanted to have much more control over the process. And the committees were more of a channel of carrying out the leadership agenda rather than having ideas bubbling up from the committees. So after I left, OPAGA was stripped of its legislative authority. The director now serves at the pleasure of the 2 presiding officers, and a number of reported issues went from about 60 to about 12 per year. And most of the rest of the information comes out as memoranda to leadership that never see the light of day to members. So it's just a fundamentally different issue now. I mean, they still do good work. It's just nowhere near as independent as it used to be. And that is not unique to Florida. North Carolina just eliminated its program evaluation division for the General Assembly because they issued a couple of reports that some powerful people didn't like. So I mean, the idea of creating a quasi-independent institution at the legislative level is just, it doesn't fit well with the political dynamics of the day when things are so polarized.
Right. And just to add, that's great insight. I'd love to talk to you more offline about your work at OPAGA.
Yeah.
I serve on DAP. We've only met like once, and it's no reason. Like it's almost like a fake committee you're on. Staff do all the work. The committee chairman doesn't have any agenda. It's just kind of a gavel, and that's it. So there's just so much. I mean, you mentioned in your presentation that the budget, you have limited resources, and I agree with you. Florida's a low tax state, so we struggle to have the funds to meet all the social needs we have in front of us. But I will add that with the American Rescue Plan coming, the budget really isn't that tight this session, and we're going to have a lot of money, and that it cannot be used for tax breaks. And so my thing too is that let's spend that in infrastructure. Let's spend that, of course, within the restrictions that Congress has set for us, but there's a lot of opportunities to do some good with that money in child welfare as well as anything else. So, we've been very aggressive on that front and trying to put the money into the areas where evidence tells us we need it for some long-term impact. So I definitely will reach out to you separately and want to talk more.
Yeah, I'll be back in Tallahassee on Monday, and I'd be happy to come over and chat. So.
Oh, perfect. Okay, cool. That sounds great. Yeah, I'm here all weekend too, so I'm not going to weekend, but I'll reach out one more time.
Okay.
Rachel, I just saw a question. That's you should maybe email Justin Miller. He might be able to help you with that.
Okay, perfect. Thank you so much. Yeah, they would absolutely love this and they need the information. So
I think it's just justin.miller at UCF, but if you are signed up, you've gotten a bajillion or 2 emails from him, you can just reply to one of those.
perfect. Thank you so much. Sorry to interrupt. I'm doing this, so just thank you for everything this is doing. So, thank you.
Great. Thank you for joining us. As Brittany said, we've got now about 2 minutes. Does anyone have a final question or comment for our presenters?
Just a quick add, maybe Jerry and Anna might say something about, I know Wapaga, I get regular emails, reports are not quite convincing, but I still get it. But there's a new entity, relatively independent, Florida Policy Institute. You think anything they do in terms of policy analysis as well as independent reports is helping in terms of evidence-based decision-making or guiding some better policies?
Yeah, I mean, it really depends on how they're working with the process. I mean, evidence never speaks for itself. So you have to have this process of bringing it into the system. And then the question always becomes how that evidence is going to be used. So, I mean, I think that we desperately need more sources that are producing, objective information, because the system is awash now with politically slanted information from, which happens on both sides, particularly from the right with all of the conservative think tanks that exist in the state. So I think it can be helpful. It really depends on how it's going to be set up and how it views its agenda in terms of working with the system, maintaining some independence, and also then being engaged enough that it's not just another ivory tower, place spitting out reports that nobody reads. So, I mean, I think there's a number of challenges in utilization that any organization that is trying to produce unbiased information faces.
And I think with that, we are perfectly on the dot at 10:30. Just another round of thanks and applause to all of our presenters. Asnat and Anna, thank you so much for teaching me this morning. I look forward to seeing your paper. Rebecca and Anna, send me your paper. Gary, it's good to see you again. If you want me to connect you with Akeem or Doug for the question you emailed me about, that would be no problem.
Yeah, I would just like to mention, if anyone wants to see the report, Better Choices, it's available on the Leroy Collins Institute webpage at FSU. So
good work. Thank you all again so much. I appreciate it. I learned a lot. Hasnat and Anna, please be in touch. I'm really excited about your project too.
Thank you very much.
Y'all have a good rest of the day. Thank y'all so much.
Thank you.
Thank you, Brittany.